Hello and welcome to my channel, Penny Prepper. Today's video we're going to be discussing medical terminology for preppers. Before we get started today, I'm going to ask that you click the like button and subscribe if you're into emergency preparedness, the outdoors, and just learning some new skills. Now, normally I don't talk about myself in my videos as far as my past history, but this is one that I do have extensive knowledge in. I was an EMT for 6 years. I was a firefighter. And basically, I know a decent amount of medical information. Am I a doctor? No, by any means. But a lot of times, the basic life-saving skills are taught to EMTs and paramedics and nurses, people more on the front line. Those are the people that if you have a traumatic injury that needs patched up long enough to get you to longer-term care, those are the people that know how to get you stable enough to actually get you to that further medical care. Also, something else that I don't normally do on my videos is ask for more subscribers. I only need 30 more to make it to my 100 mark. This is the road to 100. If I hit that mark, YouTube will start pushing my videos out, and hopefully that will get me more views, more subscribers, and I can continue making great content like I have been. So if you're just watching this video for the first time, give it a subscribe. You can always unsubscribe later if you're not into the content. But also liking the video and commenting does a great deal for my channel. Right into the meat and potatoes. So we're going to be going over some terms and acronyms for medical terminology. The first one is going to be sample. Basically, you use a lot of these terms to evaluate and assess somebody. So it starts off with signs and symptoms. So that could be what you're noticing. So shortness of breath, maybe their skin is flush, or maybe they are just experiencing pain. That is a sign or a symptom, depending on what it is. Next one is going to be allergies. Basically, that's to, first of all, get an idea of what type of medication you are able to give them to either reverse or combat whatever signs or symptoms they're having, but also to get an assessment. Maybe they are having an allergic reaction and they are not understanding that. Or maybe they have an allergy to a certain medication and they don't realize either what they took or what they've ingested or eaten contains that specific allergen. Next one is going to be medications. So that's medications being taken. Also, you can ask them, hey, did you take any medication or pills? A lot of times people will not tell you of certain medications that they are taking that is not prescribed. But also on top of that, if you ask them, hey, do you take any medications? They may say no, and then you say, are you prescribed any medications? And they might say, oh yeah, I take blood pressure medication and nitro for whenever, my chest is feeling tight. And a lot of people don't think about that when they're telling you. Next one is going to be hugely important. That's past medical history. So if they say, I think I'm having a heart attack, and you say, have you ever had a heart attack before? And they say, no. Well, maybe it's not a heart attack, maybe it's indigestion. However, if you say, have you ever had a heart attack? And they say, yes, I have, and it feels exactly the same as last time, but it feels worse, then chances are they're probably having a heart attack. A lot of times people who have allergies, they may, when you say this question to them, they'll say, oh, I was stung by a bee, and last time, it took me 10 minutes and my throat closed up. And you say, well, we got called 5 minutes ago, so we better get you your EpiPen and get you to the hospital. All right, the L stands for last oral intake. So that could be water, food, any type of pills or medication. Pretty much you're just going with what they ate, what they drank, anything that they swallowed. As far as other types of things such as drugs, hopefully they tell you during the course where you ask about medication, but it doesn't always happen that way. Most of the time they will not tell you because they're afraid they're going to get in trouble. Last one is going to be E, events leading up to the incident. Basically, that's where you ask them, hey, what happened prior to this event coming on? Were you swimming? Did you eat right before the incident? Were you straining yourself? Were you cutting wood? Were you working out? this is where you try to piece things together with all the other information that you just had, such as, they say that they were running outside in the grass and all of a sudden they felt a sharp pain in their back and thought that it was a heart attack. Well, maybe you can say, well, what were you doing when you were running through the field or wherever they were running? They might say, oh, I was throwing frisbee or catching football. Then you can say, oh, well, when you threw, is that when it happened or is it afterwards? And they might be like, oh, well, I threw it and then all of a sudden I felt this pain in my back. And then you can be like, oh, chances are you probably pulled a muscle, but you know what, you're still going to err on the side of safety, take their vital signs and get them to the hospital because that's what they called you for. But in this case, you're just checking and you can probably say, well, you're a 20-year-old dude. It's probably not a heart attack, but you should still err on the side of safety. All right, this one is more for the preppers that are going to be involved with. This is something that you can use whenever you're out in the field and there's a traumatic injury. This is where that comes in. So it's called DCAP BTLS. So it stands for deformities, contusions, which is bruises, abrasions, punctures and penetration. Next part, burns, tenderness, lacerations, which is cuts, and swelling. Unfortunately, this is one that I got very good at because being with the fire department and ambulance in a city, routinely I was going on traumatic calls. So basically, deformities, contusions, abrasions, penetration are all something that you can probably feel pretty easily. The burns, tenderness, and swelling are things that as you feel them, chances are the person is going to tell you, hey, that's tender, that hurts, if they're conscious. And then in that case, you can basically assess, look at it, and what you're doing is called palpating. It's where you are feeling the area. And also what you're doing as you're doing that is you're doing the same thing on each side as you work your way down. Because what you can do is, if you feel that this shoulder is sunken down and this shoulder is up or normal, you might feel that and go, something's wrong here. And you might feel it, and sometimes you can feel some crunching, or maybe there's a sunken down section that you're like, that doesn't feel quite right. That would be a deformity. All right, the next one is OPQRST. OPQRST. So that's going to be the onset of the signs and symptoms, the provocation and the quality, radiation/region, severity, and time. So basically, that can give you a great way of understanding when it happened, how bad is it, and give you an idea of if you need to either try to assess them on scene or get them out of there. If they are saying it's 10 out of 10 pain, a great question to ask them, what is the most pain you've experienced or what is the worst injury you've ever sustained? If they say that they've got a paper cut and you say, well, what was that out of 10? They might say, 7 out of 10. Well, chances are if they have a, cut on their finger, they might say it's a 10 out of 10. Well, when we say 10 out of 10, we're talking about somebody who is not going to be able to answer that question. They are in so much pain that chances are they're not going to be able to focus on you. They're going to be crying or screaming. Closer to the 8s, 9s, that's somebody who's able to rationalize and tell you it hurts a lot. They want to get to the hospital. 7s are more like, it hurts a lot and they are in a lot of pain. 6s, typically that's more like, it really hurts, but I can stand it. 5s are more, hey, I'm hurt. I need to go to the hospital to get checked out. Anything under that is pretty mundane, but once you start getting up past 6, 7, that's when you're probably going to have to move them quickly to the hospital. All right, this one's going to be easy. ABC. It's so easy, it's ABC easy. So basically that stands for airway, breathing, circulation. That's something that you're taught as far as CPR and AED training. That's one of those where if the person doesn't have an airway, that is your number one priority. So if they have something in the mouth, whether it's snot, fluids, mud, or blood. You try to clear out their airway in order to get them air, because if you were to breathe into their mouth, it's not going to help them. Next is breathing. Are they breathing? Are their lungs capable of breathing? Do they have fluid in the lungs? Stuff like that. Now, chances are you're not going to be able to relieve the pressure on their lungs, but you can always give compressions. And last is circulation. By giving chest compressions, you are providing circulation of, you're pumping their blood for them through the heart. So the airway is the most important, and then breathing, circulation. If you have one of those that fails, you're going to have a bad time. All right, next is ALOC, A-L-O-C. That stands for altered level of consciousness. You'll hear that a lot in terms of somebody who's either intoxicated on drugs or maybe just having a diabetic issue. Next, we're going to have CVA. That stands for cerebral vascular accident. In plain terms, that's a stroke. Next, we're going to have VFib and AFib. Basically, VFib is ventricular fibrillation. AFib is atrial fibrillation. These are issues with the heart. Typically, people will refer to them as heart attacks. Also, another one I want to touch on real quick before I forget is something called angina. You're probably going to hear that a lot when it comes to heart conditions or people who take nitro or nitroglycerin tabs. That is basically another condition. It is not a heart attack. All right, I did my best to speed through as many of those as I could, as quickly as I could. So that's the nice thing about YouTube. You can always go back and either write it down or try to, go through it multiple times to learn it. So if you'd like to, go back through and learn a little bit more. If you would like to see a more in-depth video, please comment and let me know, and I can go into more detail on pretty much any of these topics. All right, this next part is going to be a little bit of education, but also a little bit of a challenge. I'm going to let you guys know that you should start by going on something like the Red Cross and the American Heart Association websites, seeing what types of itinerary they have online as far as educational materials, classes for CPR, AED, and anything else that they might have listed. There is a wealth of knowledge on these websites. And yes, sometimes they do contradict each other a little bit because they are competing agencies and they do their own independent research. I know at one point I was learning how to do American Red Cross CPR and the Heart Association version of CPR. And when I was taking my EMT test, it was hard to remember which one was which based on which test. And really, one focused more on compressions, whereas one still was focused on the 30 and 2. Also, as far as the infant compressions, it varied. If you would like to take those classes, go on the American Red Cross website or the American Heart Association, look up a CPR or an AD class, and from there, a lot of times what you'll be able to do is you'll see that there's other classes that require that as a minimum, and you can compound upon that. There's things like first responder classes. You can get your EMT certification, become a paramedic, a nurse, even one day become a doctor or a surgeon. We're going to start wrapping this up by going over some other things that you really need to consider as far as prepping. It's going to be things like mental health, proper nutrition, oral care, foot care, OBGYNs. There are a lot of specialties out there where these are things that they have specialties and detailed knowledge of certain areas of the body or certain conditions that people may have. So this is one of those things where if you find somebody that has that type of knowledge, especially in an SHTF situation, try to pair up with them and help them, and maybe down the road they will be able to help you. All right, that's all we have for today's video. If there's anything you would like to see in the upcoming videos, please let me know. Also, the next video I do should be number 50. So stay tuned, stay safe, and stay prepared.